Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. The CareCredit credit card can help you get the look you've always wanted now. CareCredit is offered at hundreds of thousands of locations nationwide for things like cosmetic surgery, injectables, and other beauty procedures. Today, we're in Los Angeles, California with Dr. Shirley Soleiman. Dr. Soleiman is a board-certified physician and injectables specialist and the founder of the Cosmetic Injectables Center in Sherman Oaks, California. Today we're talking about how to build collagen and the different procedures. So what actually causes you to lose collagen?
Aging is, of course, a big part of it and just genetics. But outside of that, there are things that you can control, things like smoking, ultraviolet light, taking too much sugar, or having a poor diet. Things like that can increase your risk of losing collagen a little bit faster or as you age.
When would someone actually need collagen therapy?
So it's really good for anyone because when you're younger, you can help to prevent collagen loss. And as you get older, you can help to treat collagen loss. Collagen, just as much as it's a slow loss over your whole life, it's also a slow gain because we can't inject it. So we have to just induce collagen production. And the body is very slow in producing collagen. And so starting early is important because then you can maintain as opposed to wait till you lose a lot and then try to reverse it.
And I know one form of collagen, to stimulate collagen, is microneedling. So how exactly does that procedure work?
So if you've ever had a cut, you would see how first you scab within a few hours and then your skin grows over that scab, right? And replaces that scab. That's the cascade that we try to hack into. When you make these tiny little dots into the skin, these micro cuts that you can't really visualize, but they're there, the body thinks you have a cut and it starts producing those proteins that help the healing process start to take place. And then also, if you've noticed, when you get a scab, the skin starts to get tighter, tighter, tighter. So that's the same principle that happens when you have these little microscopic cuts into the skin starts to shrink a little bit. So while you're producing collagen, while you're producing new growth of skin, and even shedding some of the old skin to allow the new skin to take its place in a more even manner or healed manner, you're also getting a lot of tightening.
And how much would a microneedling procedure cost?
I'd say anywhere between maybe $250 to maybe $500 a session. I would also add to that you can add PRP, which has its own separate cost. So you want to ask, or PRF, you want to ask about that when you're price shopping.
And talk to me a little bit about collagen injectables. What are the difference between the two?
Great question. So collagen is no longer FDA approved in the United States.
Okay.
So injection of collagen would be very uneven, lumpy. We just don't do it.
Okay.
The best way to get collagen is to induce it. Okay. So you kind of make the skin produce that collagen. And there are a lot of variety of ways. There's things like creams like Retin-A. There are radiofrequencies. So there's the heat type of producing collagen. Again, lasers, radiofrequency falling into that category. There's trauma that can produce collagen. That's the microneedling, causing the body to try to heal. So then it induces the collagen production. And then there's irritation of the skin that can also induce collagen. So if you're putting things like threads underneath the skin, the body doesn't like threads. So it creates a defense mechanism. It tries to create a cocoon around that thread. And that cocoon is collagen production, exactly in the direction you put the thread. So again, it's a bit slow, but over time, if you just keep working on it, then you can increase your collagen firmness of the skin over the long term of your life.
And how long do these various collagen treatments last?
Once the collagen is produced, it lasts about 2 years.
Okay.
And as long as you continue the treatment process, then you can add to that longevity.
We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on building collagen. So what other procedures induce collagen? Is there maybe like 2 or 3 in your mind that are the most effective?
I think they're all good. It's really important to try to hit each problem from different angles.
Okay.
There's benefits from each of these procedures, right? I really like PRP and PRF, I must say, because you're bypassing all of these mechanisms that induce the release of protein and just taking the protein directly and all of the healing ingredients from the bloodstream and injecting it into the area that you want to treat. Having said that, I think threads, for example, last under the skin for about 6 months, inducing collagen the entire 6 months.
Is there one procedure, I know you kind of touched on this, but is there one procedure over another that you think is the most effective out of these that you mentioned?
I think they're all effective. It just depends which one you can afford, which one you can tolerate as far as your pain level. If you're nearby and you can have repetitive treatments versus you just want a one-time treatment, then that would determine which product would be best for you. But I would mix and match. Again, variety of different manners will get you the best results.
And I know it might be a little hard to, pinpoint, but what would be the maybe estimated cost for some of these various procedures that you mentioned?
Yes, to your point, it can be a variety of different costs, anywhere from maybe a one-time $100 treatment for maybe radiofrequency, all the way up to maybe a $5,000 procedure for doing a full face thread treatment. So it can range, and your provider can actually help you determine, based on your budget, what would be right for you.
Now, do you offer any financing options for patients that maybe need that?
We sure do, and it's very helpful for them. It's helpful for us to actually get to the results, the efficiency and the efficacy that we want. I would say CareCredit has been helpful. Regular credit card usage is something where patients can do. We also have a membership program where patients pay monthly, and then the funds add up and they can utilize it towards their treatment. So we have a variety of ways,
Is there maybe one memory or one moment in your career that stood out to you as being something that was very special to you that you want to share?
I really enjoy when I can help someone in a big way change their life. I had one patient that underwent a huge facial reconstructive surgery and had lost half of her face because of cancer.
Wow.
And this patient couldn't afford fillers. So through my affiliation with Allergan, the company that makes Botox and Juvederm, I'm faculty for them. So I was able to use her as a model and just basically cover all the costs through that company, and while teaching someone how to do it and how to achieve symmetry. And she and her family were all in tears, just grateful for the big impact that she had in her life, because she was afraid to smile, she was afraid to go out of the house. It was just uncomfortable for her. And it was really rewarding seeing that kind of impact in someone's life just by doing something that you and I would consider so simple.
Well, thank you so much for sharing all of your knowledge, and we so enjoyed having you here with us today.
Thank you so much for having me.
Thank you for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.